Hi, this is Dr. Kang's Scuba Diving Stories, and today's story is on Meniere's disease. Can somebody with Meniere's disease dive? This is a question I received from one of my fellow divers, that he felt giddy and was diagnosed as Meniere's disease. The doctor said you should never dive, and he says, I'm a scuba instructor. Should I really stop diving and seek another career? The doctor is right in a way, but there's certain other things that we have to consider, and I hope by now he's back to diving. There will be some overview of the disease, symptoms, complications, management, and the diving. Meniere's disease, what is it? It's the disease of the inner ear, usually unilateral, lucky enough. It seems like most of the organs that we have, two organs that we have, the disease comes unilaterally, except kidneys. Somehow the glomerulonephritis, they never come on one side, they come on both sides. Anyway, it comes at any age, but mostly between the young and the middle year. That's the time of the onset. And this is a very chronic disease, very recurrent, and it's very resistant to treatment. But still there are various treatment modalities which can help relieve the symptoms. Some abnormal amount of inner ear fluid, endolymph, accumulates in the middle ear, and it's not being evacuated. And still, this disease is very idiopathic, meaning we don't really know the exact cause. There are some factors that affect the inner ear fluid accumulation, which includes some anatomical abnormality will block the inner ear fluid drainage. Abnormal immune response, like autoimmune. But this one, for me, is hard to believe, because if it is autoimmune, it usually comes on both sides. Viral infection, genetic predisposition, this is true. My mother has it, I will have it, and my kids are very likely to have it. But it's not 100% so. Allergy, migraine, head trauma, they are all related to the possible causing factors. Symptoms, hearing loss, dizziness, and ear ringing. It's a tinnitus. Those are three symptom triad. Earfulness, fatigue. There are other symptoms as well. The characteristic of this disease, symptoms comes and goes. It's very fluctuating. And at the beginning, it comes very sharply, and then it goes away for a long time, and then it comes back. But as time goes on, the episode comes more frequently, and then the symptom stays longer, which means eventually this disease can deteriorate the inner ear function, sometimes completely, or sometimes you want to finish this disease by surgery. So complications, permanent hearing loss, deafness, fatigue and stress, you lose balance and you might fall and get in some accidents, like when you're driving, you feel dizzy and then there will be some traffic accident as well. Management. There are quite a few number of management or treatment modalities. We give some motion sickness medication or anti-nausea medications, including some digestives. Rehabilitation. Hearing aid helps for hearing loss. Meniere device. This is something that I didn't have when I was undergoing training. Also, for very many years, while I was working very actively in ENT clinic, though my subspecialty was head and neck surgery, this one I didn't have. And I checked around with some otologists, and this is available, and this helps. And I don't know, it's some sound energy pushing down the inner ear and relieves the symptom. Surgical procedures are available. So like I will show you by the end of the slide again, but inner ear fluid will remain in inner ear, and also it will accumulate in inner ear endolymphatic sac. So when there's a lot of inner ear fluid, the sac needs to expand, but because of the bony covering, sac cannot expand. So we do drill the bony part and expose the sac, and then sac can expand and can relieve the symptom. Other things, the sensation, hearing and balance is transmitted to the brain via cranial nerve number 8, which is vestibulocochlear nerve. So we do cut it to relieve the symptom. It has good effect. Labyrinthectomy also. So it means before the disease completely kill the inner ear, we kill it surgically. Then has very high effectiveness in treating the symptoms. But eventually we lose the hearing, but the dizziness goes away. So Meniere's disease with diving, when you have active symptoms, we should not dive. You can confuse if the Meniere's disease symptom begin or appear underwater, we can find it difficult to differentiate between Meniere's and inner ear decompression sickness and orthobaric vertigo. This can confuse the whole situation. So when you have active episodes of symptoms, or when you are getting close to next Meniere's symptom that you can expect to come, because it comes and goes and most people know it can come pretty soon. If it goes away today, it will not come next week. So it's not safe, but still you can choose your time of diving in between the fluctuations. But still, you have to consider other options as well. So either we do the operation, but with problem with operation, you can lose your middle ear cavity. So that means you cannot dive too. So when you have Meniere's disease, conclusively, it's safer that you don't dive. And Meniere's disease, today I talked about the causes, symptoms, complications, and management. With diving, with Meniere's disease, diving is not recommended. Let me show you this part. This is the inner ear three semicircular canal, and the blueness is the inner ear fluid and the lymph. And these will accumulate here when there is too much fluid in here. But this cannot expand. So there is a bony covering here that we drill out. Then the sac will expand and the symptom is relieved. And today's story was about the Meniere's disease and diving. And thank you very much for your attention, and I'll see you soon.